For the first time, the federal government is indicating now it is investigating a potential cancer cluster in workers at NC State's Poe Hall. The university shut down the building late last year after detecting high levels of PCB chemicals, which are associated with certain types of cancer. This update comes from a letter leaked exclusively to WRAL's Keely Arthur. Keely.
Dan, this is a big update. From the start, Poe Hall workers tried to report their cancer cases to NC State and the state health department, but both organizations said they were not collecting that information. While seeing the need, WRAL Investigates began tracking the cases, the time spent in Poe Hall, the types of cancer. And we compared local cancer rates and found here in 2022 alone, the rate of breast cancer was 3 times higher in Poe Hall. This summer, we brought that information to the CDC and asked why they weren't investigating a potential cancer cluster. This letter said this month says they now are. When hazardous levels of cancer-causing chemicals were found in Poe Hall's HVAC system, Kate Norwalk had one question.
I wondered if the building gave me cancer.
Now the former associate professor and so many others.
We're talking about this one building.
On October 4th, a letter sent from NIOSH, a division of the CDC, asked the state health department to compare Poe Hall workers with cancer cases in the state's registry and analyze if their cancer rates are higher than the general population. The goal, to determine if a cancer cluster exists at Poe Hall.
Yeah, cancer's out there for sure, but at this level, compared to any other building.
The investigation is an extension of NIOSH's health hazard assessment of Poe Hall, initiated in February, 3 months after the building closed. It will follow the CDC's guidelines for examining unusual patterns of cancer and environmental concerns, using it to study cancer among Poe Hall workers, but it will not include students, who make up a large portion of our reported cases.
That is completely unfair and irresponsible.
Now, we reached out to NC State and the Department of Health, the State Department of Health, to confirm they received the letter. In just the last 10 minutes, both of them say yes, they have the letter, and they plan on cooperating in this federal investigation.